Hi everybody, Dr. Hall with you here, continuing on with male reproductive abnormalities. So 6B, we're looking specifically at abnormalities of the scrotum. Now you could say that inguinal hernia is an abnormality of the scrotum, but it's kind of an abnormality of the barrier into the scrotum. So I included it in the previous section and not this one. So let's just remind ourselves of normal scrotal anatomy. So you have two halves, right? And there's a little wall in between them. And on each side, you have the testicle with its epididymis curved around it. And then you have the vas deferens, the pampiniform plexus of veins, the testicular artery, and the nerve. So those are the structures. And then, of course, remember in the wall of the scrotum, we have that dartos muscle that can raise and lower the scrotum as needed. Here's another diagram where you can see that pampiniform plexus quite beautifully, as well as the vas deferens, and they didn't label it, but you can see that red testicular artery. So the first condition I want to talk to you about is varicocele. So this one's pretty easy to remember because of the name, because it's basically that you have varicose veins in the scrotum. So the veins of that pampiniform plexus of veins have become enlarged and dilated. So you can see in the diagram below, the veins are just much bigger and fatter than they would be typically. And in the image up above, you can see it almost looks like you can see these little worms almost in the scrotum, and those are those enlarged, dilated veins. So varicocele is basically varicose veins of the scrotum, enlarged, dilated veins of that pampiniform plexus. So it's usually not that bothersome to the person. It's usually not a big problem, but it can cause some discomfort, especially an aching kind of sensation after prolonged standing or weightlifting or anything that increases abdominal pressure. There is sometimes some association with low sperm count in people who have this, and we don't know if that's a causative thing or not. So if it's mild and not bothersome to the person and they're not having problems with fertility, we'll usually just leave it alone. But if it's really uncomfortable or there are fertility problems, then they'll do surgery like they would on bad varicose veins on somebody's legs, same kind of thing. What causes this? We don't really know. Bad luck, probably. All right. The next thing we're going to talk about is spermatocele. So cele, C-E-L-E, means a fluid-filled cyst in medicine. So this is a cyst that forms off of the epididymis. So it's a nice opportunity for us to remind ourselves about that C-shaped, looks like it comes this way in the diagram, C-shaped thing that sits on top of the testicle, right, in the male. And you can get a cyst and it can have some sperm in it, hence the name. It can cause a little discomfort, but it's harmless and doesn't usually need to be treated unless it's really bothering someone. Okay, so it's pretty common, totally benign and harmless. Similar to a spermatocele is a hydrocele. So now hydro means water. So this is just a fluid-filled sac. Instead of being a little cyst off the epididymis, though, it's kind of this bigger cyst of fluid, as you can see in the diagram at the left. It's often something that's just kind of present at birth, that's kind of left over before things sealed off after the testicles came through. And usually no treatment is needed and it will resolve on its own. In case you're wondering what the glowing scrotum in that middle picture is, so that is actually, someone comes in with an enlarged scrotum and the question is this a fluid-filled cyst like a spermatocele or a hydrocele, or is this a solid mass like a tumor? And so a way to tell if something is fluid-filled or solid is to shine a pen light up against it. So I hope you can kind of see here, physician has positioned a pen light, like a little mini flashlight, up against the scrotum, and you can see it's just kind of lighting up. So the light's able to travel through, so you know it is fluid. It's not a solid mass. It's just filled with fluid. So that's kind of a little test that we can do in the office, which is fun. So normally these are present at birth, but if they develop later in life, that can be due to injury, so you get kicked or you have a wreck on your bike or something like that, or inflammation. So if it's something that comes on later in life, especially in an adolescent, young adult, adult male, with no injury, then we have to say, oh, well, gosh, maybe there's an infection there that's causing that problem. So sometimes it can be a sign that we need to look for an underlying cause, such as an infection, but usually it's just something that's present at birth and goes away on its own, or it's in response to an injury, and that will also go away on its own. So the last one we're going to talk about is testicular torsion. Torsion means a twisting and a pulling. And so what this is, when you think about that spermatic cord that's kind of hanging down, I don't have a good, right? So it's kind of hanging down. You've got your vas deferens, your pampiniform plexus, testicular artery, and your nerve. And then the testicle is kind of hanging off of that, right? And so it can happen that it can twist. And if it twists, think about what happened if you kink off a hose, right? So if it twists enough, then it will cut off the blood supply to and from the testicles. So if that happens, that's actually an emergency because the testicles can't survive for very long. The cells in the testicles can't survive for very long without good blood flow in and out. So this is the only one of the scrotal abnormalities that we're talking about that is actually a medical emergency. If this happens to you or a friend, you need to go to the emergency room right away. Do not stop. Do not pass go. Do not collect $200. Do not wait to see if it's better in the morning. Chances are you won't want to wait to see if it's better in the morning because usually this is a fairly sudden onset, although sometimes it can be a little bit gradual, of severe testicular pain, often so severe that it can be associated with nausea or vomiting. Something feels really quite wrong. And so if that happens, you need to go to the emergency room and they'll take a look with an ultrasound and check the Doppler flow and see if there's blood flow to and from the testicle. Sometimes it turns out somebody just had an infection like chlamydia or something that caused some pain. That can happen, but we always want to make sure it's not testicular torsion. So you see the gray box again. So I'm going to show you an image of someone who has testicular torsion, although this is not necessarily typical. It happens to be a particularly severe case. I think that's how you get your picture on the internet, is if it's a really severe case. So if you don't want to look, now it's time to close your eyes, and here it comes. And so there's an image. We can see obviously something is very wrong with this scrotum, right? That the person's left side of the scrotum is swollen and red, and it looks like it's just about ready to pop, right? So that swelling and that fluid is in response to this really severe problem of no blood flow to and from the testicle. All right, you can look again. I've made it go away if you had your eyes closed. All right. So again, this is an emergency, and what they'll do at the hospital is they'll do surgery. So they'll actually go in, to the scrotum, untwist the testicle, and then kind of fix it down in place and kind of secure it to the testicular wall so that it can't twist again in the future, right? Because that can be a really big problem. All right, so for scrotal abnormalities, varicocele, which was varicose veins of the scrotum, annoying, but usually not a big problem. Spermatocele was that little cyst off the epididymis, also harmless. Hydrocele, fluid around the testicle, most commonly present at birth and goes away on its own, but can occur in response to an injury or infection. And then testicular torsion, which is that medical emergency where the testicle twists and that kinks off the blood supply, and the testicle can die unless the person gets medical attention for that right away. And that's it for scrotal abnormalities.